There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what are the treatments for high blood pressure? Answer by Ray Schilling. Treatment of high blood pressure. Treatment of high blood pressure has improved vastly after the Second World War with the introduction of diuretic medication and the subsequent introduction of beta blockers in the 1960s. This led to significant prolongation of the life expectancy in hypertensive patients throughout the world. Further, with the introduction of home monitoring devices that allows a patient to adjust medication according to blood pressure readings, a patient can expect to add about 10 to 20 years of life over a lifetime. However, it is important to point out that despite that progress, about 30% of patients do not know that they are hypertensive, and as Rev. 2 stated, only 25% get adequate antihypertensive treatment. The following recommendations will be useful for most of the patients with hypertension, but you should seek the advice of your physician to ensure that you will get optimal antihypertensive therapy with a minimum of side effects. The objective is bringing T blood pressure under control with the help of medication. Blood pressure therapy is an ongoing maintenance program, not a magic cure. Do not stop taking the medication without the advice of a doctor, or you run the risk of a sudden stroke or heart attack. Steps for controlling blood pressure. Only very few people will be able to control their blood pressure by dietary changes, drastically reducing alcohol intake, less than 1 ounce per day, and restricting the sodium intake to less than 2 grams per day. It is safer to treat the high blood pressure with medication while changing lifestyles and habits, and then reducing or phasing out the medication at a future date. I vividly remember a patient of mine who was in her 80s, was sharp in her mind, but also was resistant to the advice of taking medicine. Within only 2 months she got a massive stroke, from which she died within 3 days. Life is too precious to risk a stroke or a heart attack. Here is the standard approach to high blood pressure. Individualized blood pressure therapy. Rev. 4 points out that physicians need to switch from indiscriminate therapy to individualized therapy. In other words, every patient with high blood pressure has a right to the best therapy for his/her particular situation. We need to know about the side effects, which are all listed in the physician's desk reference book. The physician needs to balance the pros and cons and come up with the right combination, if necessary, to control the patient's blood pressure and bring it down to below 120/80. In patients above the age of 80 years, the limit is 140/90. The patient, on the other hand, does his/her part by watching the lifestyle factors and doing the home blood pressure readings on a regular basis. There may be some weight loss necessary. Exercise may have to be introduced to improve the blood cholesterol levels. The physician will give you additional advice such as a low-fat, low-refined carbohydrate diet and what to do and what to avoid. His advice is crucial, not only the medication. Rev. 9. P. 505. What counts is that you are comfortable taking care of your own blood pressure problem. You need all the help you can get, from the physician, from the medication, from your lifestyle changes. It is for your life. In this context, it is interesting to note, mentioned in Rev. 10, that a group of Belgian cardiologists noticed that exercise alone could reduce blood pressure in people with hypertension by 7 points systolic and 5 points diastolic, 7/5 reduction. Researchers at Duke University Medical Center added the diet to exercise, and there was a reduction of 16/10, 16 systolic and 10 diastolic. As Brian points out, both exercise and the diet are increasing nitric oxide in the blood, which dilates veins and arteries, just as the blood pressure medication does. The only difference is that eating beets, kale and green leaf vegetables and doing regular moderate exercise will not have any undesirable side effects. So try this first and add as little medication as you need on top of this. It is time that not only 12.5 million, but all of the 50 million, 100% hypertensive Americans in the U.S. get treated adequately. The same type of reasoning applies to the rest of the world. References correspond to this link. Treatment of high blood pressure, Net Health Book. Answer by Manisha Saxena. High blood pressure. These symptoms may mean you have this, so lower down your blood pressure. High blood pressure is defined as high tension in the arteries, which are the vessels that carry blood from the heart to the rest of the body. Anyone whose blood pressure is 140/90ths of a millimeter Hg or more for a sustained period is said to have high blood pressure, or hypertension. People who are determined with high blood pressure should have their blood pressure checked frequently. Even if yours is normal, you should have it checked at least once every 5 years, and more often if you have any contributory factors. If the high blood pressure is not treated or controlled, the excessive pressure on the artery walls can lead to damage of the blood vessels, cardiovascular disease, as well as vital organs. The extent of damage depends on 2 factors: the severity of the high blood pressure and how long it goes on for untreated. Even though there is no any cause identified for essential high blood pressure, however, there is very strong evidence linking some risk factors to the likelihood of developing the condition. Treatment for high blood pressure depends on several factors, such as severity, associated risks of developing stroke or cardiovascular disease, etc. Answer by Nagendra Sharma. Medication, lifestyle changes and diet control and consultation with physician can reduce BP substantially. Following measures can improve blood pressure substantially. Regular exercise for 40 NTS. It could be walking, cycling, or any aerobic exercise need not be rigorous. It improves oxygen absorption capacity of lungs, faster blood circulation to supply oxygen to all the body parts and vital organs. Weight reduction brings down BP substantially. If overweight, plan a weight reduction program with a professional expert. Low salt diet. Bring down salt intake to 5 grams a day. May adjust a bit according to your exercises or sweating pattern. Change in food habits. Reduce saturated fat intake and increase fruits and vegetables consumption. That will also help in weight reduction. No alcohol and tobacco in any form. Give 20 NTS for pranayama and meditation to improve stress levels.